Good morning, everyone. A warm welcome to Dare to Care. For those who have joined us for the past 2 days, welcome back. This is the 4th day of our virtual experience and we hope you're having fun. Do note that we have an ongoing leaderboard and contest section for participants to win attractive prizes. We're actually launching one contest today, which you can go and participate in after this session. A hint, pay attention as much as you can today so you can do well in that contest. Some housekeeping rules. Do remember to upvote your questions by using the Q&A button. We won't be able to answer all the questions, but your votes will help to guide us. We'll also be having some polls later on. And do note that the polls are right beside the Q&A button. Now, without further delay, can I invite Fu Cui Fen to give us the opening introduction? Cui Fen is from the Strategic Human Resources, Scholarships and Awards Department at SingHealth. Cui Fen, please.
Okay, thank you, Nigel, for the introduction. So good morning, everyone. Thank you for taking the time to join us this morning to learn more about the future of nursing. My name is Cui Fen from SingHealth Strategic HR, and I'll be the MC for this event. What does the future hold for nursing? Today, we will hear from our SingHealth specialty nurses on how nursing is already evolving with the times and the role of technology in transforming nursing care. This is an overview of our program for the day. We'll start off with an overview of SingHealth nursing, watch a video on the misconceptions of the nursing profession, go through a case study on the future of nursing, and lastly, to end off the session, we will also be debunking some common first aid myths. We have an exciting program lined up for you today, so do stay on with us till the end of the session. Without further ado, I would like to invite Ms. Ng Gek Nai, Deputy Group Chief Nurse, SingHealth, to give us an overview of SingHealth nursing. Ms. Ng, please.
Hi, good morning, everyone. So let me share my screen. Can everyone see my screen? Yep, I believe so. So again, a very good morning to all friends and colleagues. So my name is Gek Nai, and I'm the Deputy Group Chief Nurse of SingHealth. Today, I will just spend a couple of minutes just to go through with you what is SingHealth all about and also the future of nursing in SingHealth. So many of you would already know that our current public healthcare delivery network actually split into mainly 3 clusters. So we are the one in the SingHealth, okay, as you can see here. So within the SingHealth, we have SGH, Changi General Hospital, Sengkang Hospital, KK Women's and Children Hospital, National Cancer Center, National Dental Center, National Heart Center, National Neuroscience Institute, National Eye Center, Sengkang Community Hospital, SingHealth Polyclinic, and of course, we also have the Duke NUS Medical School. So probably you are too young to know about this, but within SingHealth institutions actually has undergone numerous transformations since the establishment nearly 200 years ago. So you can see the tremendous change, in these 200 years. And all these changes is to respond to the, changing needs of our Singaporeans. So within the SingHealth, we have 42 specialty across the SingHealth group. SGH campus, which is the largest concentration of the tertiary healthcare facility in Singapore. And we have KK campus, which focuses on the women's and children health. Changi General Hospital, with focus on the regional health system for eastern population. While Sengkang Hospital focus on the healthcare for the northeast residents of Singapore. Polyclinics for disease preventions, primary healthcare and family medicine. And of course, we have the SingHealth Connection, which is a vibrant administrative hub. And on-site in SGH campus, we also have the affiliated medical school on-site, which is Duke NUS Medical School with us. So we are the largest public healthcare sector cluster in Singapore. So nurses form the majority part of our manpower, which is close to 10,000 of nurses. We have admin and auxiliary support staff. We have allied health professionals. we have the medical teams as well as the dentists that kind of like, put together close to 28,000 people within the SingHealth. And we are the major training center for healthcare workers. So every single day, we have close to about thousands of students. They are actually posted in the SingHealth in the various institutions that I mentioned. Medical is close to about 386, nursing about 472, and allied health and pharmacies is about 180 every single day. So as an academic medical center, we play a national role in transforming care and also to improve our patients' life. So we have the responsibility to look at the cutting edge and also the tertiary and quaternary care for the patients who are admitted in the acute care setting. But very important, we continue to actually improve our patients' life and helps the population stay healthy in the community. And that is where the regional health systems will be important, which is to support the community and the population health. So just a little bit about our SingHealth community nurses, a very important aspect of our care, anchoring in the home and the community. So as we all know, when the patients get sick, they are admitted in a hospital. So that is where they are staying in a hospital for the acute care management. But ultimately, it is important to look at the co-transitions of the care into the post-hospital patients, whereby they go back to the home to be cared for in the community, and some unfortunate cases where they need the palliative care management at home or in the community. So we have close to 67 SingHealth community nurses that is cut across mainly in the east side of the Singapore. And so far we have served close to 16,000 of the unique residents reach out to date. Okay, for the eastern side, close to about 8,000, close to about 9,000. Southern east side, about 7,000, and the northeast side, this is about 21 residents. So as you can see on these slides, we have 31 Southeast Community Nurse Posts, 24 East Community Nursing Posts, and the Northeast side, we have 2 Community Nurse Posts to actually serve these residents out there. And this is one of the latest innovations or initiative that the community nurses have actually put forth. So they actually have commenced their telehealth initiative. As we all know, we are in the COVID situations, face-to-face in meetings or even consultations may not be really possible and easy. So SingHealth community nurses actually put together the telehealth initiative, and this was actually successfully rolled out in a couple of the residents and the community areas. Our nurses actually don't only just practice the best clinical bedside care, but we continue to get our nurses and encourage our nurses to practice at the top of their competency. So the nursing roles actually has evolved over the years significantly. Our nurses have taken on expanded role, which include nurse-led clinic, meaning that the nurses will be running clinics, seeing patients in the outpatient setting, in the community setting, just now I've mentioned. They also have a nurse-led protocol to help to better manage our patient in the care setting. Our nurses, which is the specialty group, which under the advanced practice nurses, also started with the collaborative prescribing rights, meaning that our trained APNs with after going through this collaborative prescribing training, they are able to prescribe some of the medication. Okay, so this was started in 2018. And the highest qualifications our nurses have is doctorate in nursing practice. Okay, so at this moment, we have close to about 152 advanced practice nurses. And in the national, we have about 267. So within SingHealth, which is actually close to 60% actually from SingHealth. 32 prescriber, 21 DNP or PhD prepared nurses. So we know that it is important for nurses not only just to actually hone their skill at the clinical bedside, but it's also continue to reinvent the nursing through the innovation, the research and transformations. So change, it becomes very constant for us. We must always challenge ourselves to look beyond what we are doing today and to tap on the available resources like innovations, research, to transform the way that we actually put forth our practice. So we need to continue to engage our patients and also to empower our patients to kind of come along with us to see how we can actually improve the whole entire care processes. And it is also important to promote the healing environment, safe environment for our patients when they are cared for in the facility, and so that they can be able to function, fully when they go back to their home or back to their, community. And of course, like I mentioned, change is constant, and there are changes in the way we provide the care, and we need to actually always look out for how we can actually provide the better and safer care for our patients. So as a SingHealth nurses, we have a very structured career progressions for our nurses. So as nurses joining us, obviously they will go through some form of formal training from the school. After they have completed the or graduated from the school, when they first join in, they always start from the the staff nurses level, or for the IT students will be the enrolled nurses. So they will actually work their way through that learning and continuous development. And our career track at this moment is actually looking into research, education, management, clinical, and informatics. But of course, there will be more to come. Example will be the transformation innovations career track that is made possible for our nurses. And people are our valuable asset. We take care of people, and that's where it is so important for SingHealth to come together and form a SingHealth Staff Care Center. This is a one-stop virtual center to enable our staff accessible to mental wellness resources, including peer support and staff counseling. So as we know, nurses work pretty hard, and we know that we need some help and some support along the way as we actually care for our patients in a complex environment. So peer support actually is very important. So these SingHealth Staff Care Centers help set up various initiatives to help to reach out to our staff, whether it's a new staff, our staff who is in practice, or staff who actually may come across in certain timing when they find, some challenging situations. So we have staff care resources. We have also peer support initiative. Many so-called lunchtime talks are available for mental health awareness. We have also very structured way to allow our staff, if anytime they will need help, there is a number for them to call to actually ask for help and support. So this is very important. Again, I want to stress that staff is health and mental wellness is very important, and we must look after our people. So of course, nurses form the very important manpower in the healthcare sector. We celebrate our nurses, and we always celebrate the Nurses Day. So this is just some pictures before the COVID. There was always a walkabout, wishing all the nurses a happy Nurses Day, and there was senior leadership coming up to performance for our nurses and really greeting our nurses. So we always look forward for this Nurses Day. So yes, unfortunately, because of the COVID, in 2020, many institutions were not able to actually come together and celebrate like what you see on the slides, but we still go on a Zoom platform to actually wish our nurses a happy Nurses Day and thank all the nurses for their contribution they have made for our patients. We also give out awards and recognitions to our nurses who have contributed significantly, in the healthcare sector. And of course, we, together with our nurses, we always reach out to the community, to those who actually needed our help. So we often have especially the one on the Nurses Day and the President's Challenge. Nurses often have a lot of great ideas coming together, to put forth some initiative to raise funds for our needies. And we always look out, for the opportunity to help the less fortunate one in the community. And of course, we also do have the, missions trip, to the areas, to the country who are less fortunate. So this is really my last slide. Just want to, share with everyone that nurses is really our pride of SingHealth, and we treasure every single one of them. And yes, then definitely they are very important family members in the SingHealth family. Thank you very much.
Thank you, Ms. Ng, for the insightful sharing on the overview of SingHealth nursing, as well as to give us a glimpse of what we can expect in the future of nursing care. Yeah. Next, what are some misconceptions do you have about nursing? Today, we have Ms. Pamela Tan, a Year 4 NUS nursing student, who is also a member of the SingHealth Nursing Students Council, will address some of the common misconceptions about the nursing profession. Let us now watch a video.
Hi, my name is Pamela. I'm a Year 4 nursing student at NUS. Today, I'll be going to be debunking 5 misconceptions about nursing. In response to each question, I have to hold up these yes and no cards and explain why.
Is nursing considered a last resort for people who aren't able to get into the courses they want?
My answer to this is no, because I do know of some people who didn't manage to get into their desired course due to their low grades, and that's why they chose nursing. The funny thing is, for this group of people, they actually enjoy nursing in the end. And there are also another group of people whom I've met who got straight A's for A-levels, or they had a high GPA from poly, but they chose nursing as their first choice because they had a passion for it. So I think it's quite unfair to say that nursing is the last resort, because we all come in with different motivations and reasons. And I think the consensus is that all of us eventually find it to be very meaningful.
Since it's quite easy to get into nursing, does this mean the course is also very easy to pass?
My answer to this is no. Like any other course out there, there's a lot of new material for us to learn, be it knowledge or skills. So it really varies based on your individual aptitude and attitude. Some may find it easy and some may find it challenging, but one thing for sure is that you will need to put in hard work in order to make it through the course.
Is it true that a lot of people join nursing because they couldn't make it into medical school?
My answer for this is no. I think it's important to acknowledge that medicine and nursing, they are very different in terms of job scope and practice. You can't have one without the other. So whichever you choose, you will be part of a team that offers the best care to patients. I've heard stories of my seniors who have made the jump to medicine after nursing. But usually, more often than not, most of my nursing seniors, they stay on, even though some of them are actually eligible for medicine school. So for their reason is that they see the nurses spend more time with patients as compared to other healthcare professionals, and to them that is very meaningful, and there's the human touch. So if you are deciding between both, I think you just need to consider for yourself which role gives you the most satisfaction. Either way, I just know that you will be making a difference in the life and health of someone else.
Do nurses only do simple tasks like changing diapers and showering patients? Why do you need to go to school for that?
No, these are just really two of the many different things that we do as a nurse. There are way more tasks and responsibilities encompassed in the role of a nurse, especially when you become more senior and you begin to pass on the basic care activities to your junior nurses to take care. Secondly, these are also more than just simple tasks, as these are opportunities for us to observe the patients and their recovery. So we assess for abnormalities and relate back to other factors such as their diagnosis and environment to enhance their care plan. And in order for us to do that, we need to have a strong fundamental understanding on the different diseases and science behind our observation. For this, we also take non-biology related skills such as mental health and research, which gives us a fuller picture in caring for the patient. So for example, like changing diapers, it's just very simple, like it looks very simple, right? Like anyone can do it. But actually behind it, we need to learn and practice how to turn the patient in such a way depending on the mobility status, and also observe for any skin integrity issues such as skin breakdown or pressure sores, and also the characteristics and amount of the feces, to know whether or not the patient is eating well, or what kind of other treatment they need to liaise with the doctors.
Do women make better nurses than men?
No, definitely not. Nursing is really a profession for everyone. It's not easier or that ladies do better. It's our skills, knowledge, aptitude and attitude that help us to be better nurses. And all of these have nothing to do with gender. There are also many men who are excellent nurses, and some have gone on to become respected nursing leaders. In nursing school, I also met a lot of guys who are actually very competent and very good in their skills, and there's a lot to learn from each other as well. I think that people will always have certain misconceptions about nursing. There are tough times, but in my 4 years of being a student nurse, I've come to see that nursing allows me to contribute to patients' health in an up-close and personal manner. I'm able to work as part of a healthcare team to discuss ideas and developments in a patient's condition. Most importantly, I get to help my patients on their road to recovery, which is something I really treasure. And if you think this is what you would like to experience as well, yes, join me as a nurse and join us on this exciting and rewarding journey in nursing.
We hope you enjoyed the video and have cleared some of the misconceptions that you have about nursing. So for the next segment, we'll move on to our case study on the future of nursing. In this case study, we'll follow the story of Mrs. Tan and her encounters with the different nurses at the various touchpoints and how they would provide care for Mrs. Tan. Before we venture into the case study, let us first watch a video on the story of Mrs. Tan, a 60-year-old diabetic patient who broke her foot while on the way back home from her daily grocery shopping. We hope you enjoyed that little video. Now, to start off the case study proper, let us invite Ms. Tan Kiki, Senior Nurse Manager at Sengkang General Hospital's Emergency Department, who will share with us on what happens when Mrs. Tan arrives at the hospital. Kiki, please.
Hi, good morning, everyone. Thank you, Trifen, for the introduction. A brief introduction of myself. I graduated from Nanyang Polytechnic in 1997. I'm the third cohort batch in the nursing group. I've been working in the emergency department since then. In the emergency department, we see all types of patients, ranging from the very young to the very old. So we see chest pain, we see fever complaints, we see breathlessness, fracture, trauma-related. So in the case scenario, Mrs. Tan was in excruciating pain and was immediately ferried to the nearest hospital by ambulance. Upon diagnosis, it was confirmed that she has fractured her foot and requires surgery. Let me do a walkabout for the arrival for Mrs. Tan. So this is the entrance for the ambulance where they will drop off Mrs. Tan at the door. We'll proceed to do a triaging where the nurses will take a basic history, will screen her for travel history, fever complaints, coughing if there is, and we'll take her blood pressure, pulse, temperature, and pain score. She will then be moved to the designated location. So just to share a bit further, in any situation where the patient comes in with any fever complaint or positive travel history, we will need to isolate patient in the isolation room in the emergency department. As for the resusc bay, should there be any abnormal vital signs or any unstable condition in the patient, this patient will be brought to the resusc bay. And one good point about this is that X-ray facilities are all installed in every cubicle. So for the journey of Mrs. Tan, the nurses at the triage will do a tagging for her. This is what we call a real-time location system RTLS tagging for her. So patient will be moved from one location to another location without missing her. In the emergency department, we also utilize the automated medication cabinet where we will remove the medications that's ordered by the doctor. So example, antibiotic, painkillers, or any control drug related. To share with you a bit of the past, in the past, we have always been using a pen and paper, using on the medication record. When patients for admission, we will use this admission form to indicate the class admission, the admitting discipline, and who is the doctor who admit. And then the nurses will do their charting from here. So at present, we have been using an electronic charting, which will enter our nurses entry. For example, the general condition of the patient on arrival, what is their vital signs. We also use the bed management system to do a bed booking of the patient. And class status will be done in the system as well. So essentially, there is a minimum communication over the phone and manual work for the nurses. Okay, as for the order list, the nurses can view the medication order in the system. So including drug allergy status, what time was ordered, who did the ordering, and should there be any clarification, the doctor, the nurses can approach the doctor for some clarifications. So in the current practice, there's actually more autonomy and empowerment for the nurses. So nurses are allowed to order X-ray, order painkillers before a consultation actually happens. So there's also a dashboard at the waiting area for the next of kin to know what's the update on their loved one in the emergency department. So moving forward for the future of nursing, so currently we have the system which will have a split page for inpatient medication order and an outpatient emergency medication order. So moving forward, we have intent to do a merging of the medication order into one page. Essentially, this is to avoid medication error. Also, we want to use a network to auto pull weight and height of patient once measured, because currently, most of us is actually doing a manual entry on the weight and height. This is more for serving of medication to give a precise dose for patients. And then the last one is the auto triggering of updates to the next of kin when patient arrive in the ward. And currently, the nurses are doing a manual triggering of the SMS to the next of kin. So it's quite a manual work actually. So we are hoping that this auto triggering will actually save a lot of manpower time. So back to the case study. So Mrs. Tan has gotten a bed and is now heading to the inpatient ward for further management. Okay, thank you. That's the end of my presentation.
Thank you, Kiki. Now, from the story shared earlier, we know that Mrs. Tan was confirmed to have fractured her foot, required surgery, and was admitted into the hospital. In the middle of the night, she was feeling anxious and sought help from the nurse on duty. Today, we have two nurses who will share a little more with us on this touch point. Firstly, we we have Mr. Eugene Han Weijie, an informatics nurse currently working in a Singapore General Hospital, who will share with us on his role of an informatics nurse and how they play a part in conceptualizing the use of an iPad in the ward. Eugene, please.
Hello, good morning, everyone. I'm Eugene Tan. I'm a senior staff nurse at SGH Nursing Informatics. So a little bit about myself. I've graduated from Bachelor of Science in Nursing at NUS about 5 years ago, after which I've joined SGH and worked as an orthopedic nurse. And in between, I also done my advanced diploma in orthopedic nursing at Nanyang Polytechnic. So currently I'm in informatics nursing, and I would like to just share some simple pointers on what we do. Starting from the top in a clockwise manner, we do educate nurses on informatics related nursing workflow, such as the knowledge-based medication administration. We also support nurses when they have queries on related nursing workflow or right-side their technical inquiries. Doing rollout of technology such as ECG system, medical device integrations, as well as the teaching of the nurses how to use the iPad system, we do provide on-site support during the rollout of such technology and make sure that they are aware of how to use the devices, as well as how to teach their patients how to use them. In terms of electronic nurse documentations, we do also help when the nurses want to create new documentation or make improvements to existing flow sheets and order sets. Last but not least, we also look into compliance monitoring for adherence to related nursing policies. So just a simple slide on the left side is when my colleague and I, we actually conducted a hands-on session to teach the nurses how to sync the ECG into the iECG system. And on the right is when we actually round the wards routinely to provide guidance to the nurses. So in terms of future of nursing, currently we actually use medical device integration, such as syncing blood pressure readings and vital signs readings into the system, but electronically. This will actually reduce transcription work by the nurses. We also teach the nurses the iPad communication ability, and we are also involved in the SingHealth Nursing Informatics Council. In the near future, we are also contributing to the Emerging Tech and Data track of the Academic Medicine Innovation Institute that SingHealth is intending to create. And long-term wise, there'll be greater support required from nursing informatics as there are new technologies such as wearables and invisibles and AI strategies that are extensively taken up to serve as future nursing solutions. So back to our case study, in the middle of the night, Mrs. Tan was feeling anxious about her surgery and sought help from the nurses on duty. So before I go into the new iPad nursing workflow, which APN Raja will cover more on it later on, the current nursing workflow involves the patient pressing the call bell and the nurse has to go to the bedside to ask about their inquiries. After the patient verbalizes the request, the nurse will respond immediately or direct the request to the right person. However, with the iPad nursing workflow, the patient can enter their request directly onto the iPad and the nurses can read it from where they are immediately. From there, they can go and retrieve the items or reply the patient via the iPad. So for example, if the patient requires for a cup of water, the nurse can actually get a cup of water first before going to the bedside. So there's benefits of this system. So from the left, firstly is resource management. In this era of COVID-19, especially for patients who are on airborne precautions or contact precautions, the nurses actually will save on one round of personal protective equipment for each nurse call. So this is actually very important because just last year when we had shortages of PPE, this is actually quite crucial that we actually save on unnecessary patient encounters. In terms of patient safety and time allocation, nurses can actually focus on completing existing tasks. For example, if they're serving medications, they can complete their tasks first before attending to the patient's needs. With this, there will be fewer call bells ringing in the hospital environment as well, which will definitely improve the ward's soundscape And this is especially important for patients who are in the 4-bedders, 6-bedders, or even 8-bedders, where they are sharing the room with other patients, and this will actually help to reduce the noise level, especially at night. Last but not least, in terms of infection prevention and control, we do reduce the unnecessary physical contact, which is once again very important in this COVID-19 era. And it actually paves way for future contactless responses, such as robots to deliver items. So robots are actually in use to deliver items in hotels and restaurants, such as Hai Di Lao. So this technology can actually be used, this technology which is already existing can be used when it comes to simple procedures or assistance required, such as a patient wanting a cup of water, some snacks, or an extra towel. So with this, the nurse can actually delegate the role to the robot and actually can have more time to be spent on higher level duties of care. On the right side, there's a robot called Tammy. So actually, Tammy is in use for the wards which are where there's actually no television for the patients. So currently, most patient lounges are actually closed due to reduction in social mingling among patients. But Tammy, this robot, will actually go around to interact with the patients and actually provide some entertainment. So yes, I hope that in the future of nursing, we can actually see more of such robots coming into play and actually supporting the nurses with their duties. So some questions that Mrs. Tan may ask is, because she is anxious, she may actually have some concerns about her care plan, which she can actually ask the nurses via the iPad. So firstly, if she actually wants to know about the investigations conducted, she could be asking the nurses, how is my blood results? In terms of future arrangement, since she's going for an emergency operation, she could ask, when is my operation scheduled? In terms of issues relating to other healthcare professionals that the nurses actually mingle with, nurses are always in the ward, so we are kind of the point person in this multidisciplinary team. And usually patients will ask us if the other healthcare professionals, such as the doctor and physiotherapists, are coming to see her. Now, she just had a fall, so she might be in pain, and she may also query on when are her pain medications next due. And lastly, for regular activities of daily living, such as requesting for food, water, or assistance, she can also ask the nurse via the iPad app. So on the right of the slide, there's just some screenshots on the iPad layout. So as you can see under the My Care app tab, the patients can actually review their blood tests, which are actually finalized. And on the right side, they are aware of who are their primary care physician or surgeon, as well as the nurses who are on rotating shift to take care of her. Her answered and unanswered questions are also written there for her reference for previous chats. So that's all for my presentation. Now I'll pass the time to APN Raja, who actually go through more on the iPad utility with the patient. Thank you.
Thank you, Eugene. Now that we've understood the value of the use of an iPad, let us hear from Ms. Raja, an advanced practice nurse from Singapore General Hospital, on how the introduction of technology such as iPads and iPhones can aid our nurses in providing better care for Mrs. Tan. Ms. Raja, please.
Hi, thank you for the introduction. Welcome all. So today I'm going to present on the Touchpoint 2B pre-surgery. So I am Raja. I'm actually a nurse clinician and an APN. I've been working in orthopedics for the past 15 years, and I've been an APN for the last 4 years, and I do more for spine patients. So what do I do on a daily basis? So I do review patients with orthopedic conditions. I collaborate with my medical doctors to plan for the patient care and come up with holistic management. I also conduct perioperative and post-operative assessment. I do follow up patients at outpatient clinics to manage their complex orthopedic wounds. I also work with the medical doctors to actually review those patients with orthopedic conditions. And also I lead nurse-led clinic for patients who require post-spine surgery review. So in this touch point, in the middle of the night, Mrs. Tan was feeling anxious about her surgery and sought help from the nurse on duty. So upon admission, Mrs. Tan will be given an iPad and taught on how to use it. So as Eugene explained, this iPad will be used to how to call for assistance, how to access information, and of course, also allow patients to have access to pre-surgery education. If you see at the images below which I have attached, so the iPad also have few uses. One is on how to call a nurse for assistance. And secondly, also provide free of education materials to prepare the patient to have better understanding of the surgery. Through pre-reading, patients is much better prepared for the surgery, and it also allows the patient to know or to ask appropriate questions regarding their surgery. And it also provides us individualized oriented education materials for patients so that it is very individualized. So let's look through the various apps. So if you see on the left, the MyCare app. This MyCare app enables patients in the ward to access to the individual care information. Meaning, if for this pertaining patient, she is able to know when is the surgery is scheduled, and post-surgery she'll be able to know when is activities are timed for. For example, post-surgery she may need a physiotherapy assessment, so the time will be scheduled for her. Of course, she also would have access to her blood results, to the various information, and she also can call the nurses to meet her care needs. In this way, it is actually helpful to the patient to have a holistic kind of management for herself, and also allow nurses to actually reduce unnecessary time and actually increase the time to attend to more nursing activities. Second is the MyEdu app. MyEducation app is to access to the curated personalized education materials pertaining to the patient. With this app, it allows the patient to have information anytime and anywhere, so patients can actually re-look at the materials not just one time but few times, so they're actually more well aware. Lastly, my discharge app. This discharge app actually allows Mrs. Tan to have access to her discharge summary and also on her MC, as well as medications collection. As for our nurses, the use of the iPhone is usually starts at the start of the shift. So the iPhone is picked up and the nurse sets up the iPhone with a Face ID, and the applications are automatically downloaded. And then with the various requests, the nurse is ready to start his or her shift. So what are the things that we can do with this iPhone? Basically attend to patient needs. It also allows us to actually provide medications by performing barcode medication administration with the iPhone camera, and also allow us for patient identification for blood dispensing. It also allows us to monitor patient's vital signs and target text notification, especially when it involves a multidisciplinary communication. It allows us to answer patient's call. So this reduces time in asking what patient needs and getting back to them, and allow them to allocate more time to the real needs and medication administration. As for Mrs. Tan, definitely she would have pain prior her surgery because of the fracture. So this iPad actually provides her to get access to given needs easy. So for example, if you look at the iPad, it shows a pain diagram. So actually patient can actually let the nurses know on if their pain is not managed. So the care need is actually met as quickly as possible. The patient call barrier request is met as soon the nurse is able to attend to the patient quickly. So this is actually quite useful for the patient as the nurse as well. So thank you, everyone. Next, I pass to Ms. Shalina.
Thank you, Ms. Raja. Next, Mrs. Tan proceeds for her surgery as scheduled. What goes on behind the scene at the operating theatre? What does an operating theatre nurse do? Today, we have Ms. Shalina Wong, Assistant Director of Nursing from Singapore General Hospital's Major Operating Theatre, who will share with us the role of an operating nurse and the technological advancement in the operating theatre that will enable our nurses to perform their work better. Shalina, please.
Thank you, Cui Fen. Good morning, everyone. I'm Shalina from Singapore General Hospital, Major Operating Theatre. A little introduction of myself. I graduated as a nurse in 1996, became a peri-operative nurse in 2000 at SGH Ambulatory Surgery Center with 6 operating rooms. Was transferred to Major Operating Theatre with 26 operating room in 2019. I've worked as an operating room nurse for almost 20 years in SGH. Well, you may call me as a true blue SGH nurse. Being an operating room nurse, one is deemed to be versatile and highly competent professional working within a peri-operative team. With the advanced technology advancement in the OT setting, that has definitely enabled our nurses to work more efficiently. Today, I'm happy to share with you what is going on in the operating theatre when a patient like Mrs. Tan is scheduled for elective surgery. So the next day, Mrs. Tan went for her surgery as planned. For Mrs. Tan, undergoing surgery, identification, verification, and pre-operative checks are important. This is to ensure she is identified and verified correctly for the planned surgery. The sterile instruments required for her surgery were ordered by the operating room nurse, OR nurse in short, the day before. Staff from Sterile Supply Unit, SSU we call them, will prepare the instruments, arrange them into a trolley cart and send to operating theatre. On the day of surgery, before the start of Mrs. Tan's elective surgery, OR nurse will first perform a status check on all the sterile instrument sets. This sterile instrument sets will be scanned into the TDOT system to ensure good tracking of the sets. TDOT is a comprehensive solution within surgical asset management. It can interface with hospital IT system and manage large-scale multi-sets. It improves instruments traceability, utilization, and logistics, all while documenting every step to ensure regulatory compliance and the highest level of quality assurance and patient safety. For example, by scanning the instruments, we call it status check, TDOT system will reflect the sterilization history that all instrument sets have undergone a valid sterile process and it is safe to use on patient. TDOT system will then be updated and show that instruments is checked into the designated operating room. After performing status check on the instruments, the surgical team will come together to do a team brief. The team brief is a short, open team discussion which takes place in the morning before the surgery starts. It involves the whole surgical team, from the surgeon, the anesthetist, the nursing, and the ancillary staff. The team will discuss and work through structured topic to help planning for the expected and unexpected event. Team brief help to create an environment where the team can ask questions freely and to support each other when necessary. There are 4 independent checks conducted on Mrs. Tan pre-operatively for correct identification and verification before her surgery. The first independent check is at the ward level where Mrs. Tan is warded. She will be checked by the ward nurse. The second independent check is at the operating room reception where the ward nurse hand over Mrs. Tan to us. The third independent check is at the induction room where the anesthetic nurse took over the care. Mrs. Tan will be checked by the OR nurse who is assigned as an anesthetic nurse. An anesthetic nurse is someone who assists the anesthetist. The fourth independent check is at the operating room where the scrub nurse took over the care. Again, Mrs. Tan will be checked by the OR nurse who is assigned as a scrub or circulating nurse. A scrub or circulating nurse is someone who assists the surgeon, a nurse who works closely with the surgeon. This slide illustrates both scrub, circulating, and anesthetic nurse performing pre-op check on Mrs. Tan in the induction room. The electronic pre-operative check comes with a checklist. This electronic checklist is a document in Sunrise Surgical Care in the Citrix system. Every independent check information is found in SSC. The document is named as OT Perioperative Nursing Record. There's no hard copy required now. Surgical pre-induction sign-in involve surgeon, anesthetist, scrub nurse, circulating nurse, anesthetic nurse, and Mrs. Tan herself. It is a moment where all will come together to verify and agree with the information given. Mr. Tan will acknowledge and agree with the information. This electronic pre-induction sign-in document, which is also found in Sunrise Surgical Care, will be recorded by the security nurse. Surgical timeout is carried out before the surgeon begins the surgery on Mrs. Tan. Medically, we call it knife on skin. It is mandatory for the circulating nurse to read out the timeout checklist in the presence of the surgeon, the anesthetist, and the scrub nurse. Timeout is a surgical pause that is conducted as a final verification that includes the information like the correct patient, Mrs. Tan herself, the correct procedure, the correct site, which is the right side, the correct site of the surgery, which is the foot of Mrs. Tan. So in summary, the team pause what they are doing, listen to the readout, and to agree and acknowledge what's being read before the surgery begins. And the circulating nurse will then complete the electronic timeout checklist in the SSC. While Mrs. Tan's surgery is in progress, all the sterile instruments that are being used on Mrs. Tan will be scanned into her hospital account number, and it will be registered in the TDOT system. From the system, it will show the various type of instruments used on Mrs. Tan. Towards the end of Mrs. Tan's surgery, a surgical sign-up process is also conducted by the OR circulating nurse. Similarly to the timeout process, a sign-out process is also mandatory, and this has to be carried out before Mrs. Tan leaves the operating room. The circulating nurse will read out the sign-out checklist in the presence of the team, involving again the surgeon, anesthetist, and the scrub nurse. A sign-out checklist is also a surgical pause that is conducted as a final verification that includes information such as the swab and instruments counts are correct, any significant blood loss, any specimen to be sent for investigation, any intraoperative event to highlight to the team. And the circulating nurse will complete the electronic sign-up checklist in the SSC. After the surgery ended, Mrs. Tan will be wheeled to the post-anesthesia care unit, PACU in short, to be monitored and observed before she is deemed fit for discharge to the ward. So with this, I will hand over the care to Nurse Jessica, who will share on the post-surgery care of Mrs. Tan. Thank you.
Thank you, Shalina. Mrs. Tan's surgery was a success. However, she soon experienced pain as the effects of anesthesia began to wear off. Today, we have Ms. Jessica Yu Xia, a senior nurse clinician at Changi General Hospital, who will share with us on how she would care for Mrs. Tan and manage her pain accordingly. Jessica, please.
Thank you, Tuifen, for the kind introduction. Good morning to all of you. I'm Jessica, currently working as an advanced practice nurse in Changi General Hospital. And okay, here is a little bit about myself. I accepted the MOH scholarship 27 years ago for diploma in nursing. And last year, I attained my highest qualification, Doctor of Nursing Practice, from Duke University in USA. Currently, I'm actually practicing pain management as an advanced practice nurse at Changi General Hospital and fulfilling my responsibility in nursing education, research, and staff development. So what do I do on a daily basis? So my role as an APN or advanced practice nurse are to conduct inpatient reviews, examinations, and also plan treatments on a daily basis with a multidisciplinary team, clerk new patients that was being referred to pain service for various painful conditions, prescribe medications which are on the predetermined list. Basically, we have decided what medications I could prescribe, okay, beforehand, and provide education to patients on pain management and post-surgical care, organize and conduct clinical classroom teaching as well as research projects. Okay, here are some educational activities are actually conducted within and beyond Changi General Hospital. Okay, some photos are actually taken before COVID-19. And on the left side of the slide, basically I was leading a multidisciplinary group program for patients to improve that chronic pain management. And then on the right side is some activities that I actually conducted for nurses to improve their knowledge, clinical skills. I also run the APN-led pain clinic. Okay, so basically in the pain clinic, what do I do? So during the clinic review section, I review stable patients, and by performing history taking, physical examination, and also titrating medications, basically it's more of pain medications, and other investigations within a predetermined list and or agreement. Provide patient education on chronic pain management using a multidisciplinary approach. So basically I teach patients on how to take a balanced diet and how to remain active and how to pace their activities to reduce the flare-ups of chronic pain. And I also provide brief educations on cognitive behavioral strategies, for example, like positive thinking and effective communication and coping skills and mindfulness in chronic pain management. And make reference to other healthcare professionals, for example, podiatrists, because some of the patients may come in with diabetes and neuropathic pain. In other words, it's nerve pain. So they may need to see a podiatrist to actually take care of their foot. And also sometimes some patients who actually have financial issues and they are in need of financial assistance, I will make referral to the medical social workers to actually look into their financial help. And physiotherapists for some physiotherapy so that the patient can continue with their daily activities using the right techniques. And then in the near future, we are looking into video consult for the APN clinic so that patient doesn't have to travel down to the hospital to actually see a nurse or see a doctor. Okay, now let's continue with the case of Mrs. Tan. Okay, after surgery, Mrs. Tan soon experienced pain as the effects of anesthesia began to wear off. She was immediately prescribed medication to manage her pain. So for now, the ultimate goal for Mrs. Tan is to help her recover as soon as possible and also to prevent post-surgery complications. So after Mrs. Tan's surgery, we actually provide her with adequate pain control and also educate her on how to prevent complications. So as an advanced practice nurse specializing in acute and chronic pain management, I will review Mrs. Tan daily for complications after surgery. So for example, like chest infection, deep vein thrombosis, and also check her pain severity and tolerance to medication. So during the review, we will ask Mrs. Tan, how's her pain and how bad is the pain and whether her pain is adequately managed. And also to check whether she experiences any side effects from the medication that we have prescribed to her. And we order appropriate tests and titrate pain medication. So based on the patient's progress and also based on the needs of the patient, we can actually order some simple investigations to find out how she's actually progressing and make appropriate referrals to other professionals, especially physiotherapists for post-op patients, because currently the evidence is basically for patients to mobilize as soon as possible after surgery. This is to help prevent many post-op related complications. We also provide educations on prevention of post-surgery complications. So for example, we teach Mrs. Tan how to do deep breathing exercise, how to cough effectively, and also how to manage her pain adequately in order for her to participate in physiotherapy. And we teach her how to take care of a wound after discharge. And also to ensure that the medications were given to Mrs. Tan timely and adequately, and perform skills if required. So for example, if a patient's wound needs to be changed, I will also perform the wound dressing and also helped to teach Mrs. Tan how to take care of her wound after discharge. And also I guide and teach the junior nurses and the junior doctors during the reviews on a daily basis. So with this, we wish Mrs. Tan a speedy recovery. So now I'm going to pass to our next speaker, Mrs. Zuladia.
Thank you, Jessica. We have now come to our last touch point on follow-up care. Even though Mrs. Tan was discharged, after a few days, she noticed that her wound was not healing properly and decided to visit the polyclinic to seek further treatment. Due to her injured foot, she was advised to consider teleconsultation for future follow-ups. For our last touch point, we have Ms. Zulidia, an advanced practice nurse from SingHealth Polyclinic, who will share with us on how patient care continues in the community. Ms. Zulidia, please.
Sorry for the technical glitch. Thank you, Chufen, for the kind introduction. Good morning, everyone. I am pleased to be here and glad you are able to attend today's session. I'll be touching on discharge and follow-up care of Mrs. Tan. Before I begin, allow me to share a little bit about myself. I became a certified registered nurse in 1988 and has worked in various specialties such as the medical, surgical, obstetric and gynecology and pediatric settings. I pursued the Master in Nursing from National University of Singapore and certified as an advanced practice nurse in 2012. Currently, I am practicing as an advanced practice nurse in the polyclinic with multiple roles. On my daily routines, I run the Advanced Practice Nurse Clinic, seeing patients with chronic diseases such as diabetes, hypertension, asthma, gout, and thyroid conditions. Holistic care are provided by conducting health assessment, physical examination, order and interprets laboratory investigations, prescribes medications in accordance with the collaborative prescribing agreement, promote preventive measures such as vaccination, pap smear, and review patients' psychosocial concerns. On educator role, I teach and advise clinical expertise to fellow nurses and other healthcare team. On administrator role, I review protocols, guidelines, assess clinical competencies, conduct audits, and participates in committee work groups and presents at seminars and conferences. I also conduct research and participates in continuous quality improvement projects to improve safety, efficacy, and effective care. Now, let's get back to our patient, Mrs. Tan. Her condition stabilized and she was discharged after 5 days. However, Mrs. Tan realized that her wound was not healing properly as there was pus oozing out from it. Feeling worried, Mrs. Tan decided to visit the polyclinic to seek further treatment. Mrs. Tan was seen for dressing of her injured foot and follow up with her diabetes care. During her visit to polyclinic, Mrs. Tan expressed concerns regarding the need to travel a distance to the polyclinic for future medical with her injured foot. To help Mrs. Tan with her concerns, she was offered video consultation to help her manage the wound virtually from the convenience of her home and was also referred to the community nursing for home visit by the nurses. A study was conducted between Singapore General Hospital and SingHealth Polyclinic, where nurses advised patients on how best to manage their wound over Zoom. Mrs. Tan was identified suitable and willing to participate in the self-care, advice on wound care product, and how to perform wound dressing. She was able to use Zoom apps for the video consult via her mobile phone with broadband network. In SingHealth Polyclinic, care manager or advanced practice nurse may identify patients such as Mrs. Tan, who has needs requiring referral to the community nurse if she is agreeable. In addition, Mrs. Tan also verbalized concern about her limitation to travel to the polyclinic due to her injured foot. Community nursing aims to take person-centered care beyond hospital walls and in the community. Nurses from Singapore General Hospital, Changi General Hospital, Sengkang Hospital work closely with community partners to help elderly residents to keep well, get well, age well in their homes. The community nursing provides nurse services for the residents such as health screening, chronic disease education, or patients who need more complex care and support, especially after discharge from a hospital. The community nurses visit regularly Miss Tan at her home to ensure her injured foot is recovering well and her diabetes control is taken care of by ensuring she takes medication regularly, promote home glucose and blood pressure monitoring, and keep up with her clinic appointments. These arrangements will get Mrs. Tan with proper health and social care. Ultimately, she can continue to stay in place, age gracefully in the comfort of her own home. Thank you.
Thank you, Ms. Zulidia, and to all our nurses for bringing us through the various touch points in Mrs. Tan's care journey. We wish Mrs. Tan a speedy recovery indeed. We hope this case study has allowed you to gain a better understanding on how nursing has evolved and will evolve in the times, and the role of technology in transforming nursing care. For the last segment of our event is the debunking of common first aid myths. For this segment, I'll pass the time over to Ms. Catherine Pui, a senior nurse educator at KK Women and Children's Hospital, who will be facilitating this segment. Ms. Catherine, please.
Thank you, Cui Fen. Welcome everybody to this segment on debunking first aid myths. I am very sure that you have come across many first aid treatments and first aid skills that you would have seen on TV programs as well as on the internet. Now, how many of these first aid treatments that you have seen are facts and how many are actually myths? For example, you would have come across a first aid treatment such as inserting a spoon into a person's mouth when he has a seizure. So in this segment, I would try to debunk some of these first aid myths that you have seen. And also in this segment, I would require you to answer a series of questions through the poll. Now, first question. You can soothe a burn by applying toothpaste or condiments on it. Is it a myth or a fact, or it really depends on the situation? We'll wait for the answers to come in. Okay, I'm sure most of you would have answered it. Now, it is actually, okay, I have 75% answering that it's a myth. 10% that is a fact, and 15% of you say that it depends. Well, the fact is, it is a myth. You do not apply any condiments such as soy sauce, or some people would apply olive oil. You also do not apply things like toothpaste on the burn. For a first-degree burn, it is good to hold the burn under running water for approximately 10 minutes until there is some relief of pain. For severe burns such as second-degree and third-degree burns that exhibit blistering, swelling, and intense pain, it must be treated by a physician. Do not use ice or cold water, as it can cause frostbite. Okay. For the second myth, rub a hard-boiled egg on your bruise for quick healing. Is it a fact, a myth, or it depends? We'll wait for the answers to come in. Okay, the answers are coming in at the moment. We'll just wait for the rest of you to finish. Okay, now answers have come in. 66.7% of you think that it's a myth. Some of 11.1% say it's a fact. The rest of you, it depends. Well, for those of you who answered it depends, congratulations, you got the answers right, but I'm sorry, no prizes will be given. Okay. For any forms of bruises or injuries that you have suffered, immediately applies an ice pack on the wound to reduce internal bleeding and the swelling. And the ice should never be touched or placed on the skin directly, as this can cause an ice burn. Now, if you look at the photo should be on your screen, this is an ice burn. Even ice packs can cause ice burn. Now, if you do want your bruise to heal, for the first 1 to 2 days, you can actually use an ice pack, and warm compress should only be used after about 48 hours. So yes, you can use a warm hard-boiled egg, but you got to wait 48 hours later. Now, for the third question, place a metal spoon or a bite block into the mouth of a person having a seizure to prevent him from biting his tongue. Is it a myth, a fact, or it depends? We'll wait for the answers to come in. Okay, now, answers are in. Half of you think that it's a myth. Congratulations, that's true. It is a myth to place a metal spoon or bite block into the mouth of a person having a seizure. Now, what you need to do if you do encounter someone who's having a seizure in a public area or even at your own home, place a blanket or a coat on the floor and lie the person on it. Basically, we just want to prevent the person who's having a seizure from any injuries. Cushion the head, turn the person sideways to prevent the tongue from blocking the airway. That's very, very important. Time the seizure if you have a watch, and keep the person in this position until the seizure stops. So remember, if you do encounter somebody having a fit, do not ever try to insert anything into the mouth, because then you will run the risk of pushing the tongue back into the airway, and then it blocks the airway. Also, you might have seen on some TV programs that people actually stuff fingers into the person's mouth to prevent the person from biting his tongue. Please don't ever do that, okay? It's dangerous for yourself. Now, number 4, this is something that we commonly see back home as well as on TV. We see people putting their heads back when they have a nosebleed. Is that a myth, a fact, or does it depend on the situation? We'll wait for the answers to come in. Just a little while more before we close the poll. Okay. Yes, it's true that you do not put your head back when you have a nosebleed. Congratulations to those of you who said that this is a myth. Now, what happens when you have a nosebleed? Basically, you need to tilt your head forward, pinch your nose right at the nostrils, which is basically the soft part of the nose, for about 10 minutes. You can apply a cold compress on the bridge of your nose if you want to. After 10 minutes, release your nose, check to see if the bleeding has stopped. If it hasn't, or if the bleeding was due to an injury, for example, you were at the basketball court and the ball hit you in the face, please head to the emergency department immediately. All right, don't attempt to pinch your nose and tilt your head forward because number 1, bleeding may not stop. Number 2, you may have more severe injuries. So it's good to get the injury checked out. Now, this is the last myth or fact that we are seeing on TV as well as on the internet. Swallow rice to flush down or drink Coke or vinegar to dissolve a fishbone stuck in the throat. So basically, decide whether this is a myth or fact, or it depends on how big or small the fishbone is. All right, so you either swallow rice to flush down the fishbone, or you would drink Coke or vinegar to dissolve the fishbone so that it's easy to remove. Now decide whether this is the myth or a fact, or it depends. Okay, we just wait a little while more. The polls are coming in. All right, okay. Most of you say that it's a myth. Good, because it is a myth. Now, you never try to dislodge a fishbone by attempting to swallow rice without chewing or to drink Coke or vinegar to dissolve the fishbone. It will not work. So if you do have a fishbone stuck in your throat, cough it out. And if you can't, please seek medical treatment. Well, the reason being, if you forcefully swallow rice to flush down in an attempt to flush down the fishbone, chances are you may cause the fishbone to migrate into surrounding tissues of the throat. For example, the fishbone can get embedded into can actually migrate to the thyroid gland. Now, and if you do see the pictures on the screen, these are some of the photos of, this is a photo of a fishbone that's embedded in the base of tongue. And in order to remove this, we have to go to a doctor and they will put a scope and a pair of forceps in to remove the fishbone. There is no way you can attempt to dislodge this by using any of the methods that you see on TV sometimes. Now, that's the last of the myth that I debunked. So thank you very much. And hopefully you have learned something from this segment. And do also teach your friends about these myths and what is the actual first aid treatment that should be carried out. Thank you very much.
Thank you, Ms. Catherine. We hope that you have learned the appropriate care to adopt through this segment and what to do when you actually encounter these situations in the future. Like Ms. Catherine said, please do share these tips with your friends as well. It's very useful. Okay, so this is the end of the segment that we've prepared. We'll now move on to the Q&A segment, and I'll pass the time over back to Nigel from MOH, who will pose the questions to our panel. Thank you, Nigel.
Thank you, Cui Fen, and thank you to our nurses from SingHealth for the insightful sharing. We have come to the last segment of the program where we have the Q&A. So we have quite a bit of questions. The first question is, sorry, early question, do you have to be an extrovert to be a nurse? I thought of it last night and I'm really not sure because interactions drain me of any life. Can the nurses please advise if you are introvert and how you can overcome this? Would any of the nurses want to answer?
Maybe I can take this question. So I think as a young novice nurse, I think I was also introvert as myself. But I think if the gain of experience, the interaction with my patients and knowing more about my patient actually increase more, being more confident of myself. So actually from an introvert, you will actually become an extrovert actually overall. So it's basically learning the knowledge, knowing more about your patient will actually help you along with it. Yeah, thank you.
I agree with Ms. Raja. I'm basically an introvert and I am still an introvert. So public speaking, any forms of, I have to do a lot of teaching because I'm an educator. It does drain me mentally. And I think the point is, while we tend to be more of an extrovert at work because of all the interactions, we need to take care to care for ourselves and especially know how to recharge and be prepared for work the next day. So it's okay if you're an introvert. I know a lot of nurses who are introverts, but they are doing teaching. They are very popular with their patients. They take good care of their patients. So you don't really have to be an extrovert, but that portion may have to show when you are interacting with people.
Okay, can I add on to what the previous two speakers shared? For myself, I'm also an introvert, but I think what they have shared is true. You don't have to be an extrovert to be a nurse. So, but as an introvert, and then it's indeed actually draining to interact with so many people. But the important thing is that, along the way, we learn how to take care of ourselves after a long day of work. So we find ways to relax, to actually reflect, so that we are able to face the next day. So I think the self-care tips are important along the way if you can pick up in your nursing career.
Jessica. So I'll add on also, so I'm also an introvert and I don't think it's only limited to nursing. So nursing is one of those occupations where you have a lot of people interact with, but I think with your patients or rather the direct care, you're not always going to have all the family members there, everyone there at the same spot. I think a lot of the encounters do occur one-to-one. And I think that's where actually introverts are very, very different in the care they play. Because I think introverts generally are, they one-to-one, they perform better, they engage better. So I think it shouldn't stop you from being a nurse at all, because especially introverts, we are very quiet, we're very reflective. And I think when your patients go to you and say like, oh, I got this and that, we can be very good listeners as well. So yep.
Okay, may I just add on?
Yep, sure.
Yeah, I think be it an introvert or extrovert, you just need to be yourself. Yeah. Nobody's born to be a nurse on day one, actually.
Totally agree.
Okay, since we are on this topic, right, I think there are a few questions that have been asked around the shifts of nurses. How do you cope with the shifts? How do you cope with like palliative care patients, dealing with the loss? Maybe the nurses, you want to share how you cope with this as well, since that's a mental thing as well.
Well, I think I can share my experience. Currently I'm not doing shift. The last time when I did shift work was maybe like 10, 15 years ago. So at that time, I was young and then full of energy. So shift work wasn't really an issue, because sometimes we actually prefer shift work because you can really do certain things during the, when you're not working during office hours. So, and then you can even go out with your friends. So I think it depends on how you manage your time. So if let's say you can, because nowadays with the shift work, there is a flexibility for nurses actually request certain duties. Yeah, so that actually fits certain lifestyles. So if you know your duty, if you know your daily activities, you can actually request early to actually fix your life. So that is actually make it easier for nurses to do shift work. Secondly, is basically we need to find other activities to actually enrich our life rather than just working and doing shift work. So I think that basically helps lah. Yeah.
Yeah. I think with shift work, is one important thing is to ensure that you have enough rest. You also would have to ensure that you know how to schedule your shift around your life, basically. And of course, exercise is important, self-care is important. I tend to enjoy shift work more because I like that idea of having the entire shopping mall to myself on a weekday when it's really, really quiet, like early morning or probably early afternoon. So that's one of the pros of shift work, which I don't get to enjoy nowadays because I'm doing office hours now. The malls are packed on weekends. Terrible.
Yeah, I agree with Kathleen. I used to enjoy my shift work better than now doing office hour. I found that office hour is a little bit longer compared to shift work. So as long as actually usually the rosters are planned about 2 or a month ahead. So that's why you are able to plan your family and social activities, especially with those with children. Yeah.
Thank you,
So
nurses.
for me, I just actually ended shift work. I mean, I'm still doing shift work, but just about last year, I was doing 3 rotating shifts. So currently, for those who are doing shift work, they're actually doing 40 hours a week. While for those who are on office hours, the contract will be 42 hours a week. So shift work is a little bit shorter, and we have introduced flexi hours recently. So for every night shift that you do for SGH, we actually give you back 2 hours off. So for example, your day shift can end at 3 p.m. or even 2 p.m. So afterwards, you can actually, from 2 p.m., you can just do your own things after your morning shift. So it was quite enjoyable when I was actually doing 3 rotating shifts with this flexi hours arrangement. Yeah, but of course, it does get tiring, especially if you are from a PM shift and then you have to move to an AM shift the next day. But in terms of workflow, there is continuity of care because you are nursing the patient the day before and you already know what is going on. So the next morning when you come over, you just take over the night report and you are ready to go and take care of the patients whom you already know. So there are benefits to shift work as well. And I think it does help with the nursing workflow and it helps with your patient relations as well. Thank you.
Thank you, nurses, for sharing. I think to the audience, you don't need to worry. The nurses are the masters of care. So I think you're at a very good place where they have procedures and proper controls in place to ensure that you have the rest you need. So another question, which is, what is the main difference between nurses and doctors? Can nurses diagnose in clinical? Does a doctor outrank a nurse with a PhD? And what is the difference between the roles of that of a doctor in nursing and a medical doctor play?
Okay, I think I will go with this question. First of all, I think there are a few main differences. The first one is basically our training focus is different, when we are in school. And then secondly is once you become a nurse, our job scopes are different. Okay, so, but the most important thing is we are all part of the team. We work together collaboratively, not working on our own or silo. Okay, so I think that's the main difference. And then I think the other question says, can nurses diagnose? I think there are a few APNs in our midst. We can diagnose patients in collaboration with the physicians. So we do have a practice agreement with our physicians who are our supervisors in the clinical area. So for the APNs, we can diagnose our certain disease, and also we can manage certain disease with certain autonomy. So basically we can make the decision as how we want to investigate the patient, what kind of treatment we want to give to the patient, and what kind of medications we can give to the patient. So of course, this is in collaboration with our clinical supervisors. Yeah. Okay, so I think that it is the question on the candidate diagnose. I think that the other question is basically, okay, so in clinical, does the doctor outrank a nurse with a PhD or DNP? Okay, okay, so currently I'm actually holding a DNP post, Doctor in Nursing Practice. So the conclusion is no. Does a doctor outrank a nurse? No. As what I have said, we are all part of a team. As a multidisciplinary team who actually take care of the patients, we play our own roles according to what is actually stipulated for us as a member of the team. Okay. So, but then as a DNP holder or PhD holder in nursing, we have other added responsibilities, for example, like carry out research and be a clinical leader in nursing. So basically, look into what is the latest nursing practice in nursing and then implement it into clinical practice. Yeah. So I think that it is the answer to that. Okay, so what is the difference between the role that a doctor in nursing and the medical doctor? I think I have answered that. So basically, as a PhD and the DNP holders, you have added responsibilities in terms of research and clinical practice leadership, and also in terms of education. Yeah.
Thank you for the answer. We have another question, which is better for nursing studies, SIT or NUS? Is there any overseas uni nearby that is also recognized? So I will answer that question. Nurses, please correct me if I'm wrong. So for SIT, right, the program is more catered towards the poly nursing grads. So you will realize, I think there's a shorter course duration and our bond period is also shorter. For NUS, it's for freshies, so A-level or you're from a non-nursing diploma. So that's, I think, the difference. We can't comment on which is better in other areas. Is there any overseas uni nearby that is also recognized? I would say consider your education locally, because over the past few days we discussed with various allied health nursing professionals. I think the local context is very, very important, especially when you communicate to your patients. If they are Chinese elderly, if they are Malay aunties, if they are Indian uncles. I think the local culture itself is very important. So how you recognize the patient's needs, how they communicate to you, I think these you can learn in the local setting better. So nurses, you have anything to add on?
No, actually the nursing courses, if you would like to know which are accredited, you can go to the Singapore Nursing Board website. They would have a list of the institutions and the schools that are recognized. Yeah, but good to go locally, because there are certain culture factors that we do consider as well when we are caring for our patient. It's not just the physical care, but cultural differences also play a part when we care for patients.
I also want to add on to what Catherine says, because for the local nursing courses, right, the tutors or the lecturers are actually from the clinical area. So the schools actually invite those currently practicing nurses to come in and teach, certain topics. I think that actually adds to the relevance of the teaching and the education for the local nursing degrees or even the diploma courses. I think it is an added advantage once they actually graduate. They can straight away merge into the current practice, rather than taking some time or longer period to get used to the local environment, nursing environment. Yeah.
Thank you, nurses.
I think for myself, I'm from NUS Nursing. So I think it's actually quite a good support structure when you actually learn locally and then you make friends who end up actually going to other institutions, other setting, and you actually get to experience their background. So for example, I have friends who are now in the polyclinics, friends who are in the ICU, friends who are already taken their masters, going for PhD and so on. So actually it's quite a good idea to have a support structure in Singapore. So when you actually start work, you get to be supported through the first few years where it's actually quite critical. And in terms of difference between SIT and NUS, I think both are the same. So for NUS, it will be more for the students who have no experience. It's a pre-registration course, whereas for SIT, it's a post-registration course for nurses who already have background, say a diploma in nursing. So for the more practical points, both NUS and SIT nursing, when you start off, the pay is the same, even for your increment based on your honors grade. So I think there's not much difference to consider, but it's more about whether you're coming from a diploma in nursing background or you are from a non-related diploma background or you are from the A-level batch. Thank you.
Thank you, Eugene. Okay, another question. It's a very broad question. So can you give a brief description about the various nursing tracks, for example, educator, research, innovation? Maybe our nurses can share a bit.
I'll speak on the educator one since I'm an educator. Now, nursing educators, basically we manage the professional and educational development and training for our nurses, and also with our doctors sometimes. We will craft curriculums, design new programs based on needs analysis. So basically when we speak to our learners or when we speak to our nurses or doctors, we find out what is necessary, what programs are necessary to bridge their knowledge gap. So once we have done all those needs analysis, we will craft programs and we will design courses and workshops to train the nurses and also at times doctors to basically to care for their patients better. So some of the programs that we have are things like preceptorship. We actually train preceptors so that when new nurses or when students come in, these preceptors will take care of you and guide and supervise you as you embark on your nursing career. So this is what educators do as well. Educators also do a little bit of education research. We participate in interprofessional education and collaboration activities. So basically we'll work with our colleagues in the different healthcare professions, for example, with the medical doctors, with our allied health professionals, such as social workers and so on. We work with them to come up with training programs as well, and also to encourage or impart skills basically to help our team members from the different professions to collaborate in a better manner so that when they care for their patients, it's not in a fragmented manner. So these are some of the trainings that we come up with as well. So basically as an educators, you do teaching, and we also go into the clinical areas for our attachments. So basically we still go down to the wards to care for them, to care for the patients. And from there, we will also do clinical education, such as teaching the nursing students when they are in the wards of certain skills and procedures that they have to perform or they have to be competent in. Yeah. So yes, that's the education portion.
Thank you. Would any other ones want to share? Be an APN?
Maybe I'll share my APN perspective. So as an APN, what we do basically, we will actually do history taking, physical examination. We will actually assess the patient, come with differentials. We will order up investigations and appropriate medications or investigations in collaboration with the doctors. So that's our clinical path. As for leadership kind of for the portion, we actually formulate nursing protocols, nursing policies. We actually use evidence-based research to come out with the latest nursing activities. So this is one portion of it. We also act as an expert resource nurse. So like in orthopedics, I'm the expert resource nurse. So we actually guide and teach our nurses in the floor. We also do research pertaining to nursing activities or even to clinical issues. And definitely we also do not leave out innovation. So we actually think of best practices or how we can actually innovate patient care to a better level. So actually we have a wide range of scope to function as an APN. Thank you.
Can I add on to, okay, so I think to venture into different career track, it doesn't mean that you will go straight into your specific career track you when you join nursing. So what happens basically now is all the nurses who actually graduate, freshly from school, you have to start with general nursing practice first. Because in order to be a nurse educator, in order to be a researcher, you will need to have enough clinical experience in handling patients, in providing patient care, before you can even specialize in research or education. Because if you want to do research, you want to do education, you need the specific experience and the knowledge and the skill so that the others can benefit. Yeah, so that will probably require a few years of general nursing practice before you can actually branch into a specific track. Yeah, so for example, the nursing research track and innovation. So currently we have some nurses who are mainly doing research and innovation. So what is that track like? So basically they had a few years of general nursing practice, and then after the few years, then they find out that, okay, they actually like nursing research and innovation. They want to specialize in this area. And then for my research nurse, she actually went for a master in clinical research in overseas, which was sponsored by the hospital. And then after which that she returned, and then she actually was in charge of the research unit. So what she does basically now is she coordinates research projects among the nurses. And then she actually also help mentor nurses who are new in research. She teaches research, how to conduct research, and then how to get your research published. Yeah. And then also she works with the NUS, the honor students, and they coordinate the NUS honor students research project, because those projects has to be conducted in the clinical setting. So she becomes the licensed person and also the mentor in actually guiding the NUS students or even any other students who actually requires to do research. So there is definitely a career track for people who are interested in research and even innovation in nursing. And there is a future for them.
Thank you, nurses, for sharing. I just want to quickly answer this question. I don't think the nurses need to answer it. Do you think that nursing as a career prospect is looked down upon? If so, why? So I think for this question, right, personally, I think it's because we always see, when we go hospital, we always see what the nurses do on their rounds. We always see the things, the direct care that they do. But I think from this sharing, we can see that they do much more than just those things. They are educators. They prepare the diagnosis. They actually do a lot more, communicate with the doctor, work in teams, work with other allied health professionals. So I think to answer your question, it's not looked down upon. It's just a misconception. So, okay, another question which is about more like safety. So for other than COVID, is it common to bring home other spreadable illnesses? Sorry for being direct.
Well, okay, so I have been working in the clinical area for the past, I think I work in direct contact for the past 20 years. And so far, I have never brought any disease home or any infections home. Okay, so the important thing is because in the hospital, we have very strict infection control measures. So nurses are taught how to do your hand hygiene and then how to, look after patients who are actually have infectious disease. Yeah, so we have trainings ongoing to make sure that nurses take precautions when they actually nurse this group of patients. And then, so if you actually follow the strict infection control protocol and the preventive measures, there's just no opportunity that or no risk that you can bring any disease home. Yeah. So sometimes some nurses still feel a bit, apprehensive. So what they do is after work, they actually, wash up first before they even go home. Yeah.
I agree with Jessica. It's probably a very slim or actually no chance at all of bringing infection home if we adhere to our infection control practices. So things like before we touch our patients and after we touch our patients, we would perform hand hygiene. So either a hand wash or a hand rub. And I think all of you should be very familiar with sanitizing your hands, especially during this COVID pandemic. We have personal protective equipment, masks, gowns, and things like that. So for different types of infectious diseases, we use different types of PPEs. So with all that, plus very strict hand hygiene, we don't bring all these things back to our family members.
Yeah, may I just add on? So as compared to what we'll probably have gone through SARS, most of us in this group. So we have learned from previous practice how to do it better. So as if you have seen, the number of COVID cases or the nurses contacted with COVID cases is much lesser than last time in SARS. And SARS attacked us.
Can I chime in? Okay, I agree with the three speakers. So like for us working in theatre, I'm sure many of you will have nurses friend or you heard of nurses that say that, oh, nurses are very clean people, they're very careful. So it's like, they become part of us. So when at work, we are always, on a heightened alert, we always do our hand hygiene, like what Jessica said, infection control. So it becomes part of us. So even like for nurses at home, I'm sure most of us we always keep ourselves very clean, and even at home we make sure that our house is very clean as well. So it's very unlikely that we are able to bring back all these diseases because in hospital it's basically a very clean place.
Yeah. Besides the personal protective equipment that we are using and also good hand hygiene, we also must also keep ourselves vaccinated. For example, vaccination, get the COVID vaccination and also the influenza vaccination. And our SingHealth has always been supportive of us getting free vaccinations, even though for like vaccinations such as chickenpox. Yeah.
Thank you, nurses, for sharing. I think same with some of the questions on safety, on violent patients, things like that, right? I think all the nurses do take precautions and there are certain mechanisms in place. Like for your infectious diseases, there will be controls like they mentioned, the cleanliness and the PPE and things like that. For violent cases at home and in the hospital, I mean, the other day we had someone in community nursing discussion asked if the patient turns violent or at home, what do you do? I think nurses are trained. First of all, I think they do get a lot of angry patients in the hospital, and I mean that applies at home as well. I think if you look at today's report, there was some healthcare workers being attacked in the hospital, punched in the face or something like that. I think if you read further, you will know that the security were called in place quite immediately. So it's no different from other workplaces, be it in your office or other jobs as well. When people turn violent, we have to act and do something. No different for nurses. So I would say don't hesitate on the safety, the things that could happen and whatnot. I think the things that you gain out of the career is much more than those things. And okay, next question. It's for Miss Tan Kiki. So why do you decide to do further studies on nursing after getting your diploma? Would you advise nursing graduates to do the same?
At that point of time, I just tell myself that I know what I want. I want to do a specialty. That's where I took up emergency nursing, and I moved on to take up advanced diploma in emergency in NYP. Yeah. So essentially, it's continuous learning throughout. Yeah, don't stop at what you are now.
Thank you, Ms. Tan. I think to also elaborate, right? When you're a diploma nurse, I mean, I'm quite young also, like 30 plus, not really young, but you sometimes, you know, you study, finish your diploma, you want to get some experience first, then you go out and specialize, and you then further your studies, you explore options. Sometimes you just want to do that first. So I think like Ms. Tan mentioned, right, it really depends on your aspirations and your path that you decide to take. So another question, how often do nurses shower or clean up patients? I understand that nursing goes beyond that, but would you advise someone who is uncomfortable with taking care of others' hygiene to be a nurse?
I guess it really depends on the person's intentions. Why do they want to go into nursing practice? I'm sure all of us at one point or another, when we were junior nurses, we do get a bit frightened when we have to clean up the vomits of our patients, or we have to, like, the very first time we change diapers, or we change a dressing for a very bad bed sore. So those incidents, those times, they do frighten us. But then why do we join nursing? We join nursing because we wanted to help. We shower our patients, we change diapers for our adult patients because they are not able to do it themselves. And while we are changing diapers, while we are showering them, we are actually talking to them, engaging them, finding out if they have anything else that they need. So sometimes they only tell you their deepest secrets or their problems when you are attending to them one-on-one without other people around. And again, when we are, one of the speakers was mentioning earlier on, I think one of the students in the video, when we do showering and when we change the diapers, we are actually assessing their skin integrity. Are they in danger of developing a bed sore? Is there anything on the skin that I need to take note of? Is there anything else about the patient I need to take note of? So I wouldn't discourage, but I would ask her or him, why do you want to do nursing? It goes beyond the discomfort of caring for their hygiene. Yeah. And frankly speaking, we always feel that when we care for them in the hygiene sense, you're actually giving them they are giving them some respect as well, or you're returning some self-respect to them because they are being cleaned up. They are not disheveled or dirty or not smelling nice when people come and visit them. Yeah. Return some dignity to them in a way.
Basically, it's to do good to a person.
Yep. Thank you, Ms. Catherine and Ms. Zulidia. I think as Catherine was talking, right, it's, you know, it's also a question of if you're going to be a parent next time, why do you want kids? So you won't think of, you know, the hygiene portion that much. So nobody knows how to clean your kids' diapers and so on before you have the kid. But I think once you have your kid and, you know, you just do what you have to do. And I think nurses, they practice every day, right? Very soon you'll be quite good at what you need to do. So I think don't be discouraged in that sense. Care is something that, you know, if someone is in need, you have to care, right? You can't say, oh no, let's not do that. So don't be discouraged in that sense. So Ms. Zulidia, since you answered the last question, which was your favorite role among the multiple roles like clinician, educator, administrator, or rather which maybe you want to go into, or, you know, what's your interest in those?
Yeah, as an APN, you have to have all the roles. That means clinical, educator, research, and also other administrator role. But then, of course, I enjoy best is to be with my patients. Yeah, I see about 20 patients a day. You know, by talking to them, I get to know more about my patients, you know, about their, you know, what's happening in their life, whether, you know, are they doing well in managing their chronic disease. So that is the most enjoyable part in my life. So whenever I come out of my polyclinic, just, you know, went down to the bus stop or to the next shops around the polyclinic, they will say hi to me. That's the enjoyable part of my life, because my patients see me every 2 months, 3 months, throughout their chronic disease management. It can be many years. So, I really appreciate that, they call me Missy, outside the polyclinic. So it is good. It's a good feeling that, your patients appreciate you.
Thank you, Ms. Olivia. So, okay, let's move on. We have time for maybe 1 or 2 more questions. For Eugene, are there any restrictions of what male nurses can do? Is it true that male nurses can't help change female patients, but female nurses can help change male patients?
Hey, thank you for the question. So in other first world countries like USA and Japan, there are no differences in terms of whether a male nurse can take care of a female patient or a male patient. So in Singapore, firstly, I'd like to share that statistically, there's only about 10% plus minus male nurses. So the question would then be, is there a need for the male nurse to actually participate in very intimate care for the female patients when 90% of us are actually female? So there are a lot of roles that I, as a male nurse in the bedside, can do, such as helping to serve oral medications, intravenous medications, taking blood, setting needles, serving diet, taking their diet orders for the next day, being the in-charge nurse, doing their dressing on, say, their knee or their foot. So there are actually a lot of roles that we can play that doesn't require intimate, sensitive procedures. And I think that we have more than enough female nurses to go around for those procedures. So yes, most of the time I'll be allocated to male patients. And if there's a need for me to help out my female colleagues, there are a lot of roles that are actually required, which is not sensitive, including, say, helping them to take blood pressure, monitoring for their patients. And oftentimes, all my female colleagues, they are very helpful to me, and they will help me with my male patients as well as their own female patients. So yeah, I don't see it as a restriction, but rather it's a proper allocation of resources. In fact, most of the time, actually, they are always very helpful to take care of the female patients available around in the wards. Yeah.
Thank you, Eugene. Okay, one last question. Maybe we have one nurse share because we don't have time left. So did anyone discourage you to take up nursing? If so, how did you convince them that it was the right path for you?
My parents didn't want me to do nursing. I did my A levels in late 90s, and at that time we didn't have any nursing in NUS. So I had to go through the diploma route and obtain my diploma in nursing and then do a postgrad degree. So for my parents, they were very traditional. They were like, you have done your A levels, go to do your degree and then graduate from university and so on and so forth. So I didn't agree. I went ahead to register for my diploma in nursing. I took up a sponsorship with KK Hospital. I've been with KK since. And my mom was so upset with me that she didn't speak to me for 3 days. Very, very upset because I went behind their backs to sign up for nursing. And I guess after, so many years, we've been through SARS, we've been through H1N1 and all these things. She actually turned out to be the greatest supporter. Yeah. So I was quite worried that she might ask me to resign when SARS came along, because I was only an 8-month-old nurse at that time. But she didn't. Her view was that if every nurse quit because of SARS, then who's going to take care of the rest of the patients? So yeah, I guess I've shown her how determined I was to be a good nurse, a competent nurse, and I think she's convinced when I do that.
Thank you, Catherine. So I think let's not be discouraged to joining nursing. And with 12:01 p.m., we have now come to the end of the session with SingHealth. I think from today's sharing, we can see the experience and the wealth of experience from our nurses and the exciting career paths they have. I'm sure some of you would like to see yourselves here in their shoes in the years to come. And Bernadette, we noted what you said. So Bernadette said, love what you said, Miss Catherine, returning dignity to a patient. So I think that's another point which really indicates Catherine and her path to nursing. So
Thank you, Bernadette.
thank you. So that's all. Thank you, nurses, and we appreciate your commitment to our healthcare efforts. You may take your leave now.
Thank you, everybody.